Fatty liver disease, the silent threat. You may feel tired and blame it on work, stress, or age, but sometimes the real cause lies deeper, in the condition of your liver. Today we're talking about fatty liver disease, one of the most common health problems of modern times. According to statistics, about 1 in 3 adults has signs of fatty liver, often without even knowing it. What is this condition? Why does it develop? How dangerous is it? And most importantly, can it be reversed? Let's find out. What is fatty liver disease? Fatty liver disease, also known as hepatic steatosis, is a condition in which excess fat accumulates inside liver cells. A small amount of fat in the liver is normal, but when fat makes up more than 5 to 10% of the liver's weight, its function begins to suffer. In medical practice, this condition is often called non-alcoholic fatty liver disease, or NAFLD. It's important to understand that this form is not caused by alcohol, but by metabolic imbalance. The liver is one of the most important organs in the body. It performs more than 500 vital functions. It detoxifies the blood. It regulates fat and carbohydrate metabolism. It produces proteins and enzymes. It stores essential vitamins. When liver cells become overloaded with fat, the organ can no longer perform these tasks efficiently. Why does fatty liver develop? The main cause is metabolic dysfunction. The most common risk factors include excess body weight and obesity, insulin resistance, type 2 diabetes, high cholesterol, a sedentary lifestyle, high intake of sugar and refined carbohydrates. When we regularly consume large amounts of sweets, baked goods, fast food, and sugary drinks, blood sugar levels rise. The body produces more insulin to manage this glucose. Over time, cells become less sensitive to insulin, a condition known as insulin resistance. Excess glucose is converted into fat, and part of that fat is stored in the liver. Interestingly, fatty liver disease can also develop in people who are not overweight. Even individuals with normal body weight may experience metabolic disturbances that affect the liver. Modern lifestyle factors, prolonged sitting, chronic stress, irregular meals, only make the situation worse. What are the symptoms? Here lies the biggest danger. Fatty liver disease can remain silent for years. The liver itself does not have pain receptors. It doesn't hurt in the usual sense. Some people may experience persistent fatigue, reduced energy levels, a feeling of heaviness or discomfort in the upper right abdomen, bloating after meals. But in many cases, the condition is discovered accidentally during an ultrasound or routine blood test. That's why so many people learn about it at a later stage. What happens if it progresses? At first, the liver simply accumulates fat. At this stage, the condition is still reversible. However, if nothing changes, inflammation may develop, a more serious condition called non-alcoholic steatohepatitis, or NASH. Over time, fibrosis can form. This is when healthy liver tissue is gradually replaced by scar tissue. If the process continues, it may lead to cirrhosis, an irreversible condition in which the liver loses its structure and function. In addition, fatty liver disease significantly increases the risk of heart attack, stroke, atherosclerosis, cardiovascular disease. In many ways, fatty liver is not just a liver problem, it's a sign of overall metabolic imbalance. Can fatty liver be reversed? The good news is, yes. In its early stages, fatty liver disease is completely reversible. And the most important treatment is lifestyle change. First, weight reduction. Losing even 5 to 10% of body weight can significantly reduce fat in the liver. However, weight loss should be gradual. Rapid weight loss can actually worsen the condition. Second, nutrition. It's recommended to reduce sugar intake, limit refined flour and processed foods, avoid sugary drinks, cut back on fast food, increase vegetables and dietary fiber, include high-quality protein, add healthy fats such as fish, nuts, and olive oil. The Mediterranean-style diet has shown especially good results. Third, Physical activity, even brisk walking for 30 to 40 minutes a day, improves insulin sensitivity and helps reduce fat accumulation in the liver. You don't need an intense gym routine. Consistency is what truly matters. It's also important to monitor blood sugar and cholesterol levels, especially after the age of 40. Are there medications? Currently, there is no universal pill that can dissolve fat in the liver. Doctors may prescribe medications to improve metabolism or protect liver cells. But without lifestyle changes, the results will not be long-lasting. The foundation of treatment remains simple: healthy eating, regular movement, weight control, prevention. To reduce your risk of developing fatty liver disease,